So I'd like to call on the panelists for the next discussion, the role of the healthcare IT leader in driving innovation in tough economic times. And firstly, I'd like to call on Leonard Slabbert, head of IT at Boehringer Ingelheim, and Valter Adao, lead director, Deloitte Digital, Africa, and Dr. Anton Prisloo again, IT Director, Independent Practitioners Association Foundation, and Fezile Soyizwapi, Systems Engineer at EMC South Africa. I'd just like to get your opening comments. Just introduce yourself and then give us your opening comments on the topic.
My name is Fezile Soyizwapi. I work for EMC, Enterprise Content Division. We're mainly concerned with the management of content and ensuring organizations take content very seriously. We have a healthcare vertical solutions focus within the Enterprise Content Division, and I also have taken that focus as myself. I must warn that I recently joined the division from the Infrastructure Services Division, and I've taken quite a lot of interest in healthcare. And I'm worried that this panel is composed of doctors and only me as an ordinary person. But I'm really not worried. At EMC, especially ECD, we're mainly concerned with integrating the patient record, enabling the sharing of the patient record, and also analyzing the patient record with a view to improve patient outcomes. We have developed quite a lot of packaged and integrated solutions that enable your communication or your interoperability between your front-facing applications and your back-end applications, which would be the building of a clinical repository or data repository that is able to take care of both structured information from your health information systems and also unstructured information from your laboratories, your radiology divisions and so on, and making sense of that information in the back end and providing or perhaps presenting it to clinicians, as a unified electronic patient record. That's our mission. We are quite well tied with the Department of Gauteng, Department of Health in the Gauteng province. We are doing a number of projects with them around building their EHR capability within the province, and we are learning a lot of lessons. But one thing that I would put forward as a key milestone in the healthcare industry in South Africa is the innovations that have come up from the National Department of Health, especially the amendment of the Act, of course, to give way to or maybe authority to the normative standards framework, and also the Office of the Health Standards Compliance. I do believe we still have a long road ahead of us to traverse in order to ensure that the normative standards framework become the foundation of any healthcare IT investment in South Africa. And we are doing quite a number of projects with also the Southern African Health Technology Assessment Society to ensure that maybe we could interface with the department to try and develop some kind of a framework in terms of assisting public healthcare organizations to be able to select compliant technologies that would ensure patient safety and satisfaction in the back end.
Leonard, you're head of IT in a major organization. Tell me, what sort of role do you play in terms of driving innovation within that organization?
Boehringer is primarily in the ethical medical medicine space, and it being, as you said, multinational. The driving of innovation is, for us right now, as far as technology is concerned, is getting closer to the customer. One of the main streams that was mentioned is one of the digital levers that were mentioned in one of the presentations earlier. That's definitely one of the spaces that we're trying to looking for inventive ideas of being able to get, number one, closer to our customers. And who are the customers? it's the doctors, it's the hospitals. Those are the people that we're trying to get closer to, but also to get some analytical data out of that exercise. The analytical space for us is where we're starting to find areas of opportunity. One of the other digital levers was primarily talking about big data, and you can see a lot of the multinationals, the growing trend now is to consolidate their architectures, and by consolidating their architectures, it's actually working perfectly in line with what will happen eventually in big data, is that it will allow easier integration into that space. Something that we don't find here in South Africa, but you do find in European countries, is the pharmaceutical companies in the European countries talk to each other. It's not hiding behind these clandestine meetings. It's very open. They even have forums and they meet on a regular basis. However, in South Africa and Africa, it doesn't happen. And so for us, it's also to bring those regulatory bodies together so that we can obviously leverage that in the short term. I think we've been waiting far too long for that collaborative exercise to materialize.
Valter, your opening comments?
All right, so I lead up a unit at Deloitte Consulting called Deloitte Digital, which addresses many of the things that was just mentioned, but we go a bit further to look at any digital exponential, be it web and cloud and mobile and smart technologies at the moment, right through to 3D printing, machine learning, near artificial intelligence, and we try and incorporate that into existing businesses or the creation of new businesses so that our clients remain relevant in this onslaught of digital disruptions. So it's in a very interesting space, and I think it's a space that most organizations need to pay attention to. Prior to that, this is a recent role. Prior to that, I led a unit called Monitor Deloitte, which is our premier strategy business. I coincidentally look after the life science and healthcare sector in Africa for Deloitte. So it's quite fortuitous to be having this conversation. And then from an innovation perspective, it's got very close links into digital. I sit on the global innovation executive of our organizations, looking at the disruptions that not only our clients face, but we as an organization face. And specifically bringing this home to the world of healthcare, it's an industry that has been very innovative from a drug and molecule perspective, from a treatment perspective. But if you go back very far, as far back as you can go in terms of modern economy, there's not really been many disruptions in healthcare to the healthcare profession. And I think we're potentially facing one. And that disruption is not going to come at us from existing healthcare providers, pharmaceutical companies, funders. It's going to come from organizations that are currently not trading in healthcare. And you've seen organizations like Google and Apple showing an interest in playing in healthcare, from a wearables perspective, from a data perspective. And one of the reasons that they want to get involved into healthcare is because healthcare is such a massive contributor to GDP. One could argue until the sun sets whether or not we're making sufficient margins and profits in healthcare. The bottom line is that there's a massive spend in healthcare. And organizations that aren't in healthcare at the moment are very keen to get into healthcare.
Dr. Prisloo, you are the head of IT at the Independent Practitioners Association.
The IT solutions that's currently being developed is disrupting many of the models that the doctors were used to. To give an example, if you look, doctors always came to meetings, and at these meetings, pharmaceutical companies will, pay for the stands, and they will speakers and so on, and it's a commercial model. When you start introducing upskilling on a digital platform where the doctor can sit at home, he doesn't go to these meetings anymore because he does it from home. So you start getting resistance. So it is a challenge to be a leader in IT. What we've done at the IPA Foundation is we represent the business interest of medical practitioners in South Africa, And we saw that there was a need to also start looking at the IT interest of the doctors. What I said in the previous discussion, I mean, if you just look how the doctors are bombarded with different applications and websites. So if someone doesn't go out and say, but look, we think it's a great thing, but let's try and make sense out of these initiatives so that the doctor can participate in a meaningful manner with you. I think that's where we saw that we could play a role, and we formed then a company called Connected Care. I think why it's important to get doctors involved is a lot of some of the initiatives that comes out. Say there was a medical scheme a while ago, one of the prominent ones that launched an app that will allow the doctor to communicate with the scheme and put in some information. I mean, one of the things that came out is why doctors didn't necessarily want to participate is because they said, you know what, if the scheme now starts seeing the clinical work that they've done, they might refuse to pay for the claim that they've sent in. So there's a distrust from doctors on IT because they don't know really what's the implication going to be. And I mean, if you don't understand it or if you don't engage with the doctors to say, but look, there will be rules in place when you do engage, you are going to lose it. And I mean, that's why I think where I think we can play a role. Also, I don't think that IT, there's so many ethical issues that comes up with sharing of information when one starts looking at patients. That it is definitely a place where the doctors needs to be involved when these systems are developed. And again, that's where I think that the IPA Foundation and us can play a role. And we would like to engage with people, with the companies. And like my one friend said, Anton, you're a doctor. You can never bring an IT solution, but you can try to bring the doctor to the table. So we hope we can bring the doctor to the table.
Now I'd like to talk about emerging technology. Well, it's not emerging anymore. We're talking about the likes of cloud and big data, mobility, Internet of Things. There are so many options open to people in IT or in the IT departments. But obviously, they have to weigh the pros and cons, the benefits, and all of that. You are from the technology provider side. What are the benefits, and what should the CIO in a healthcare facility be looking at, and what sort of technologies are out there?
One thing that seems to be prevalent, especially in most healthcare initiatives, improving healthcare and also e-health initiatives, is the focus mainly on technology, and not necessarily on the other stakeholders within the whole environment, which would be, for example, your people, your clinicians, your practitioners, and also your processes in terms of the business processes within, or the business processes that govern the clinical workflows within your institutions. You'll find a situation where there's an over-focus on technology and no focus or less focus on change management. That's one area that would bring probably the IT person closer to business. But the other area is cloud, of course, which would really bring down costs in terms of having technologies deployed centrally, one instance of a technology deployed and bringing or exposing the applications of the centrally hosted cloud health information system to clinicians, citizens, and government officials through portals. But there needs to be, obviously, compatibility issues and also governance issues that need to be weighed into the whole scenario. For example, he talked of privacy, patient privacy, and also the privacy that is packaged with patient information. Those issues need to be dealt with quite a very sober mind and a very forward-looking mind, and also the inclusiveness of the operating environment itself within, let's say, for example, the private healthcare ecosystem. your life health cares, your net care, and all that. Within such environments, firstly, their customer is not necessarily the patient. Their customer is the doctor, is your radiologist, is the medical aid, and so on, which says something about their readiness to share the patient record. Now, you can have cloud, but if you have cloud only at infrastructure level and not necessarily at application level in terms of managing the clinical workflows and actually making sure that the patient record itself is kept centrally, you don't have to invest in multiple clinical repositories to ensure that you are able to deliver continuity of care. If you're not sharing the patient record, there is no greater chance of delivering continuity of care even within your own hospital. So I would say technology will always be there, but the change management aspect will always be important more than the technology itself, because people, as he said, people can always be given technology, but what then happens after they are given technology? If you're dealing with, for example, clinics, I'm just making an example. He mentioned the average age of his members to be in the 50s. If you look at the nurses in the clinics, they are our mothers, they are our grandmothers, and you bring to her a tablet and you say, now you are going to administer care using this. Obviously, you're asking her to retire. You're asking her to retire. So, whilst cloud may appear to be a solution, but if it is not wrapped with the required change management, it then just becomes a pie in the sky. We will have investments that go into building cloud environments, but if you don't build the people and process ecosystem that actually adopts the use of a shared environment, whether it's an infrastructure environment or an application environment or a repository, then of course the efforts will quite be doomed. So we need to constantly map or match the technology innovations with the people and process side in terms of change management. So that's our approach at EMC. I would say we're close to overemphasize. Whilst we're a technology company, we're close to overemphasize the requirement and the importance of change management, especially in healthcare, because as in one movie, one soldier said, we're in the business of saving lives.
Have these new technologies impacted the way you work and the solutions that you provide even within the organization?
Maybe I can give you an example. So one of the product streams that we have is in stroke treatment. From a medicine perspective, there's only a few pharmacy companies that compete in that space. There's basically two products that compete in the South African market in that, and the funders primarily only will deflect to the cheaper option. So we had to think innovatively. We had to think, how do we sell this product? And keeping in mind what was said by the gentleman a little earlier, at the end of the day, it's about the patient and his well-being, his or her well-being. And so if we kept that focus clearly in mind and with that strategy in place, they came to the tech department and said, okay, well, where can you help out? What we found is that we couldn't rely on government and we couldn't rely from the privateers to try and get something done. We had to actually set the pace. So we dug around and we done some market research, and we had to partner with a company because with stroke treatment, time is of the essence. And what we found out in the research, and we brought in a lot of professionals in the study, is that in time being of the essence, we found that there's not enough hospitals that could specialize in the remedial therapy and the immediate therapy as an intervention to treat it as quick as possible. So what we had to then find is a partner. We're in the medicine space. We invent the molecule, we market it, we manufacture it, and we sell it. So what we definitely were not is a tech company. So we had to go and find a company that was going to be able to find that patient that's basically got a stroke incident and find the nearest hospital where they could get our treatment administered to them as quick as possible. So for us, that's an example of where we used technology. Now, if we open it up a little bit more, in the emerging market space, of which Africa is part of that, I see an area of opportunity there for us. When they do research and development in other countries, it's almost a model of more for more, instead of getting more for less. They set up huge investments in R&D labs and hospitals and clinics and getting marketing companies together and to get all of this data together in order to give a little bit of innovation. And that kind of is counterproductive for me and us as a company. So what we're starting to see is that in emerging markets, necessity is the mother of invention. And what we start seeing in that space is that, for instance, Siemens in China, they just couldn't sell these huge CT scanners in China. It was too expensive, and the cost of ownership was just too high, and to have clever people running these things was just exorbitantly expensive. So they came up with a cheaper one where they could distribute more. The economies of scale obviously kicked in, and it didn't require a doctor handling this particular instrumentation. And what happened basically was a lead-off from that is they actually sold it to the mature markets, and it's selling like hotcakes. The idea came from an emerging market. And I think we mentioned it a little bit earlier. We keep thinking that life's greatest dilemmas and conundrums are going to be solved by mature markets. I just don't think that that's always the case. The problems are being experienced in the emerging market, and the solution, therefore, should come out of the emerging market. So getting back directly to your question, for us in the IT space, it's for us to be seen as facilitating the process of being able to partner with the correct people, staying informed, and being connected with the right people. So events like this would obviously contribute to that. But more importantly is being connected with the right people, with the right know-how to execute the right solution.
Before I go on, I'd like to say, look, I'd like to open this up to the floor.
One of the issues with South Africa is that we always must not forget the context that we exist in. We have a private healthcare service that is first world, and we've got a public health service that is a mix of first to third or fourth. The uptake in the private sector is very easy because we're dealing with shareholders, and in the public sector there's a lot of issues. But the bulk of the population is found in the public service, and that is where also stability has to be ensured. But in the public service, there's a lot of gaps that needs to be closed. IT needs to come into the space, but one of the things that it needs to do is to exorcise the ghost of mistrust. A lot of government programs came in with different IT solutions, and they never worked, and that creates mistrust from doctors, from operational people, to say, you are like the last 2-3 companies that came, so we'll see what happens. So we need to correct that space, to rebuild the trusts and to rebuild the vision that what is brought in to the healthcare space in particular will make it easier. Mr. Elliott, you said, we want to make the specialist life easy. I have a problem with that. Let's make the life of the patient easy. For me, that's the first statement. Let's make the life of the patient, of the population easy. Invariably, if we make the life of all the healthcare professionals easy, it will translate into that, but the focus should, let's make the life of the patient easy. And one of the challenges that South Africa has is also a flood of technology that does not work. How do you make sure that this kind of technology does not occupy this place in South Africa? Because costs is often an issue, and this technology that does not work is usually cheaper than the technology that works. But sometimes it's even more expensive than the technology that works, depending on the brand envelopes that will be shared somewhere, in some corner somewhere. For me, as a clinician, it's fearful. At the same time, it's a question of frustration to say, can I have technology that comes into my space and does what it's supposed to do? minimize waiting time, make sure that medicines are available, make sure the attitude of the healthcare worker changes, ensure their safety and security. You know, those 6 priorities. So the technology must speak to the 6 key health priorities in the country.
So I think that the issues that you raise around mistrust and the challenges between private and public are accurate, but not unique to South Africa. You go look at developed markets, some of the challenges, the depth and the degree of challenge might differ, but those challenges are there. And it speaks about, you know, which comes back to the topic of this conversation, is how do you make technology or the role of the CTO or the CIO in the organization more innovative to contribute to the healthcare outcomes. I think there's a massive disconnect in many organizations and potentially even in the public sector between what the CTO does, the technology officer of the organization, and what the strategy of the organization is. And in order to, I think, start closing the gaps that you refer to, those roles need to start coming together. Whereas technology shouldn't be playing a back office function, or digital, which is the innovative side of technology, should not be playing a back office function. It should be actively involved in developing the business strategy to get the strategy. The digital or the technology strategy should always be business strategy led, right? There's no doubt about that. We shouldn't even debate that point. But the role of the technology officer, the digital officer, needs to be a lot closer in terms of being involved in formulating that strategy. And when you get that harmony going, then it becomes a lot easier to get the right technology implemented, driving adoption, driving the change management, etc. Because then those 2 roles are working hand in hand. I think many times when you see technology failing the organization, they're worlds apart.
I picked up on the talk behind saying our private healthcare in South Africa is kind of first world. You know, I would respectfully disagree with that, because if you go to private healthcare institutions, the reason why they don't have long queues is because of the cost of getting care in those institutions. In terms of the processes inside the hospital, they are still intensively paper-based. You know, I was admitted to one hospital 2 years ago, and I had to fill in 5 forms on a daily basis every morning. 5 forms, the same information that I was filling in. And it's a private hospital, and you pay heavily to stay there. So I would like to dispel the misconception, or perhaps the misunderstanding that private healthcare in South Africa is more mature. Private healthcare in South Africa still has to go through your EMR maturity. Even inside the hospital itself, they don't share patient information. There's no continuity of care inside the hospital itself, besides the paper-intensive administrative environment and poorly managed document workflows or document lifecycle and workflows inside the hospital. So the question that they are better than public healthcare is only because of the numbers and the queues that you get, you know, when you go to a hospital, because the big numbers of people cannot afford to go to those hospitals. Maybe with the national health insurance coming in, people will start, or perhaps the private healthcare ecosystem will start, you know, bringing things closer. But I also want to make a comment around the role that I see for the Office of the Health Standards Compliance, especially in making sure that technology really finds its place or provides the value that is required. If we could learn from other countries, like for example in the US and also in Europe, they came with interoperability frameworks. They also, in the US, they went further and came with a technology assessment framework that certifies technologies, EHR technologies, EMR technologies, to say this one is compliant with the regulation, because there are issues about patient safety. If, for example, you have a CPOE software solution that does not embed, for example, our prevention from mother to child transmission guidelines in it, in terms of what is being prescribed to a patient, or what tests need to go through, a patient needs to go through in order to manage the antenatal labor and delivery and postnatal life cycle of a patient that is HIV positive. You know, things like those are not some things that we in South Africa go deeper in terms of actually checking if the system does pick up certain things. For example, if it picks up that the patient's CD4 count is below a certain threshold, then a doctor cannot prescribe certain medication for a patient that is below that threshold. Our systems don't pick up that. But in other countries or in other continents, they are able to run these tests on an ongoing basis and provide, feedback to vendors to say, look, you need to fix 1, 2, 3 in order to comply with what we say are the certified standards for your technology to be used in our ecosystem. So the government needs to sort of empower the Office of the Health Standards Compliance to ensure that at least maybe they carry a carrot and also a stick to say, if you comply, here are the incentives. Whether you're primary healthcare or you're public healthcare institution, if you comply, here are the incentives. If you don't comply until a certain date, here's the whip. So we need that type of a drive. Otherwise, we will always deal with this inequality.
My name is Eddie Sampi. I'm from the Public Health Association of South Africa. I just wanted to get some views regarding, you mentioned disruption earlier on, and everybody seems, or not everybody, but there seems to be a focus towards high-tech solutions. What are your views regarding possibly lower-tech solutions, off-the-shelf, frugally innovated, that are Africa-friendly or third-world-friendly, and that are in the hands of the people rather than coming from the system?
Swandla Masugu from Life Healthcare. I'm R&D researcher there. And one of the sort of interesting observations I've made today is there's been quite a lot of discussion around the low adoption rate of various technologies and the need for change management. And this particular panel is focused around the role of the IT leader. But I haven't heard much engagement around sort of innovative models for solution creation or conceptualization, if you want to call it. For instance, we seem to still be focusing a lot on saying, these are the technologies that the clinicians or the patients require, we're going to put them in, and then we need to figure out how to ensure appropriate training and change management so they're adopted. But clearly this has been working. So from an alternative sort of school of thought, what are you guys, or have you explored different sort of patient engagement and clinician engagement models in your solution creation? And if so, what sort of have been the results of those? Because clearly there is a huge problem, and we can discuss all we want around the different technologies and how we want to leapfrog. Unless they're adopted, they're useless. So we need to, I think it's quite important that we place a lot of emphasis around that, especially as IT leaders and practitioners.
Thanks for the question. I mean, that's my pet project. So what we've said is that the doctor is at his most productive when he is writing. And if you stick with that and you stick with the workflow of paper, that's something that we think the doctors will adopt. So what we've developed is a tablet application with a S Pen. Why the pen is, it's not a stylus, why it's important is the doctor can put his hand down on the screen and he can write ergonomically, because the doctor writes the whole day. So we've just taken the paper-based system and say, okay, the secretary will open the file in front, so it'll be an electronic file, the same things that we put onto that yellow folders when you do go to the doctor. So she completes that. She sends that file then electronically to the tablet in front of the doctor. So the doctor just sees the patients that's in his waiting room. If he then clicks on the name of the patient, there's 4 books that opens. A prescription book, a sick notebook, and a clinical notebook. And when he clicks on the clinical notebook, he get white paper and he can write just like he's been writing all along. So with that, you give him something that he's familiar with. It is a paper-based system. We will then, on that handwriting, we will show him ways, we will show him the value of digitizing certain things on this paper that is written. So for example, what I currently do is if I see a patient, I will go back in my normal practice, the patient come, you see him today, you take the blood pressure. Then you look at the blood pressure and then you wonder what was the previous blood pressure. Then you turn back and go and look where you have written it, because it's not always written at a nice place. But then you find it. So if the doctor now decides to digitize, so the same will happen with this book. He'll just have to page back in this electronic book to find it. But if he decides to digitize the blood pressure, we will give him a graph of all the blood pressures. So the value for the doctor is digitizing blood pressures, because then he doesn't have to turn back and he can start managing the patient. And that is the road that we want to take the doctor up. And then now you've got the doctor with an electronic device on his tablet, where there's connectivity, where you can now start introducing algorithms and protocols when you see certain kinds of patients. So that's the way that we've been going.
That is one approach to try and make the barriers to adoption easier on the doctor, but it's not necessarily an approach in the creation. For instance, how much initial engagement did you have in conceptualizing that solution? And that's really what I'm asking around. What are the changing forms that are being sort of utilized around solution creation? And this is not necessarily isolated in healthcare. It's a broader sort of discussion where you have some advocates saying change management is dead, for instance, because unless you take the users on the journey in the creation, they're not necessarily going to adopt later. So I'm just curious around what the sort of different implementation styles and solution conceptualization styles have been adopted by various members of the panel.
You know, the difficulty in responding accurately to your question is the position I find myself in. I work for a multinational organization that is based in the US, and when it comes to solution creation and innovations, you know, we always take the cue from head office or from our innovation centers or the CTO's office. You know, we do have an internal innovation drive in terms of submitting our ideas. For example, for my sake, I submitted an idea around an e-health cloud service delivery platform that comes together with everything. That's gonna form the basis or perhaps the backbone of what we are doing in the back end with telecom. But in terms of talking around in this market, for example, how would you develop a solution for this market, particular market? It's kind of limiting for someone working within a multinational organizational ecosystem.
If I may add to what you've just said, right? The innovation that we're seeing around technology, right? Let me just go back a step or two. Adoption is a big issue. That is, if you go back the last 10 or 20 years, in terms of the rollout and implementation of technology in the healthcare space, the biggest failure point has been adoption. There's massive programs around adoption, right? Now, if you start putting on a digital layer, and you mentioned earlier that the center of anything that you do now from an innovative perspective is the customer, irrespective of who your customer is. And a critical component to digital, the digital implementation of solutions is the design factor. All right, so, and to make it real for you is, my dad is 70 years old. I recently got him a smartphone. He's only used a feature phone, right? And my biggest concern was, would he be able to use this smartphone? All right, so I wrote off his ability to learn how to use a smartphone because he struggles with the new remote and a new TV remote. However, the design of the smartphone is so intuitive that he got it immediately. That traumatic experience one has with new technology was eliminated after the first 5 minutes. And then a few weeks later, he actually befriended me on Facebook. All right? And I've never shown him how to use Facebook. I asked my brother hadn't shown him how to use Facebook. It was a wizard that popped up that took him through how to set up a Facebook account, how to use it, etc. What made that adoption easy wasn't the coaching or the change management process. It was the pure design of the solution. And a lot of the digital innovations that have been released into the market have got a massive user experience or experience design component to it that makes it intuitive whether you're 8 years old or 80 years old. And I think that is fundamentally going to start changing the way in which we roll out technology into any sector, making it a lot easier. So what you see is you see a very smart, user-friendly skin being wrapped around very crude, potentially very crude and highly engineered technology solutions. So that's the one theme I want to get across to you. in terms of how you innovate to get to the point, right? The biggest mistake organizations make is they decide at a strategy session they're going to be innovative. And then they run a campaign the next week to say, guys, we're innovative. It's like asking this audience to be spontaneous. It's not going to happen. And so in order to start moving towards design and innovation around product, and when I talk about design and innovation, I'll answer your question now as well. It's not about 10% improvements. It is about a times 10% improvement in whatever you do. All right? And sometimes it's only enabled through high-tech solutions, but it doesn't mean it can't be enabled through low-tech solutions. So the answer is you can do it with both. But critically with that is, in order to get to the point that you're going to start innovating, first of all, you need to define the mandate. What is it that you want to innovate around? What is the problem you want to solve? What is the kind of impact that you want this innovation to have in your organization? All right? Do you want to save lives? Do you want to make money? Do you want to diversify? Define that up front. Then there's a very clear process where you ideate. And that ideation is, it's not limiting to the people that are in the business or in the industry. Open up your ideation platforms, democratize the process, because I can guarantee you the smartest people don't work for your organization. I don't mean yours, I just mean generally. That, you open up the ideation platform to get concepts into the organization. And then you work with the various stakeholders, be it your doctors, be it your patients, be it the funders, be it public sector, be it whoever that is a stakeholder in the success or failure of that product. Involve them in providing input into the process. But at the same time, you cannot allow them to limit your product based on their paradigms of what the product should be or not. If that was the case, we wouldn't see solutions like MP3s, because people didn't want MP3s. They wanted cassettes and DVD players, So it's about finding the balance around how do you get the end user to use the product effectively, but at the same time not limiting your product to what the end user wants all the time. It's a fine balance. I don't know if that addresses your point.
I think from your comment a little earlier, jugaad, have you heard of that term? It's a Hindi word, which means a quirky or just to solve the immediate problem.
Yeah.
And I think when you talk about frugal innovation, I think that is pretty much what it is. And I think what's also sort of happening as a trend inside of IT is that we're reworking some of that old technology. And I guess if I posed one question to the audience here, how much of us use all the features on our smartphones, or your Windows machine, or your iPad? I mean, there's just so much stuff that we're just not using. And so what we find is also going through the reworking process. We don't have to go through this life cycle of development right from the concept and go through the development stage and then, to develop a product. We're now almost integrating a step right at the very beginning and saying what is already existing and can we do it better. So that's frugal, what you were referring to as frugal development. The other thing is talking about when we go about into the innovation space. Innovation is being able also to find efficiencies in different processes. We hear lots of things about work processes and change management and all of those things. It's also about redefining those steps and finding innovative ways to get to the point a lot quicker. And I think in an emerging market and in the African condition, we almost don't have all the rules of a mature market that we have to jump through this hoop to get to that hoop, to get to that hoop. We could almost just get to the point of where we actually have a problem and get to the point of fixing it. And I think that's the area of opportunity where we hear earlier that we're 15 years behind. Well, we don't have to be 15 years behind. We can actually make that 10 times jump without having to follow a model that got some other country or some other organization to the point where they are now. We can actually maybe take a shortcut. And I think that's maybe where we can apply the principle of jugaad.